Come closer. Today we are going to see the cavernous sinus and its boundaries. You can see this is the area where I have reflected is the area for cavernous sinus. This is the pituitary fossa. You can see the pituitary stalk very well here, pituitary stalk. And then both the sides of the body of the sphenoid, you have the cavernous sinus. And this is the lesser wing of the sphenoid and this is the greater wing of the sphenoid. And between these two, you will be having a foramen that is called as superior orbital fissure both the sides. And here we are going to see the boundaries. Anteriorly it goes up to the superior orbital fissure, and posteriorly it is the petrous part of the temporal bone. You can see here this is the petrous part of the temporal bone and this is the superior orbital fissure. And medially you will be having the pituitary. This is the hypophysis cerebrae or pituitary fossa where you have the pituitary. Beneath that you will be having the sphenoidal air sinus. So this forms the medial relation. And then superiorly you will be having the, can you see the optic nerve and optic chiasma? This is the meeting area where the optic nerve crosses, that is the area called optic chiasma. And along with that you have the internal carotid artery here. And then we will see the lateral wall. So this is superior and will be okay. So look at this same thing only we are seeing here. So you can see here this is the body of the sphenoid. Here also we are seeing the body of the sphenoid, and both the sides of the body of the sphenoid only you have the cavernous sinus area, and anteriorly it extends up to the superior orbital fissure. You can see the fissure here, and then posteriorly it goes up to the petrous part of the temporal bone. Same structure you are seeing here, superior, anterior, posterior, and superior means above. Above you will be having the optic foramen is here. So above you have the optic foramen, optic nerve, so optic chiasma is here. In front if you go, it is the olfactory area. So olfactory nerve will be going in this area. So this is superior, and then inferior you will be having the again the sphenoidal air sinus, and then you can see the most important structure. You can see here trigeminal. This is a cave called trigeminal cave. Your trigeminal full ganglion is situated here. Okay, trigeminal cave. This is the apex of the petrous part of the temporal bone. Now you will see the lateral relations. Laterally, if you see, here is the trigeminal. Trigeminal will be divided into, you can see the two divisions of trigeminal. One is called ophthalmic, which is going here. This is ophthalmic. What I am holding is the ophthalmic, which goes via the superior orbital fissure, and the second one is the maxillary, which goes via the foramen rotunda. So I will show the two foramen here. This is superior orbital fissure. Via that only you will be having the ophthalmic, and then here is the foramen rotunda. Through that only your maxillary is going. So these two, along with that, you have one more nerve that is called as oculomotor nerve. You can see this side clearly. This is your oculomotor nerve. Along with that, a tiny nerve, trochlear nerve. This is a trochlear nerve. So oculomotor, trochlear, and then ophthalmic division of the trigeminal. Ophthalmic division of the trigeminal, maxillary division of the trigeminal. Four nerves are going along the lateral wall of the cavernous sinus, and then laterally you will be having, this is for the temporal lobe. So temporal lobe of the cerebellum. So these all forms the lateral wall, and then in floor is formed by, roof is formed by the diaphragm ocelli, which covers, that is the dural fold which covers the, can you see, this is the dural fold that covers the pituitary area, that is called diaphragm ocelli, that forms a roof, and the roof is here, and then roof is formed by the, this is the meningeal layer. This is meningeal layer of the dura mater, and the floor is formed by the endosteal layer. The endosteal layer is which is attached to the floor. Along with that you have a very important artery and the nerve. You can see here internal carotid artery is present inside. So floor also you have the internal carotid artery. Along with that you have a nerve which is lying along the internal carotid artery. Can you see the nerve? That is your abducen nerve. So abducen nerve is lying lateral to the internal, infrolateral to the internal carotid artery. So I am holding both the nerve and the blood vessel. So this is the internal carotid artery, and this is the abducen nerve. Abducen nerve forms the infrolateral relation in the floor. So roof is formed by the meningeal layer, and the floor is formed by the endosteal layer. On the floor only you will be having the internal carotid artery as well as the abducen nerve. So the internal carotid artery lies in the floor as well as it comes along the superior surface also. So it comes like this. So it forms a carotid siphon. This is about the cavernous sinus, and the cavernous sinus tributaries communications I will tell. See, communication number 1 is cavernous sinus, superior petrosal sinus, cavernous sinus via the superior petrosal sinus, transverse sinus, then the transverse sinus via that it will go to the sigmoid sinus to the internal jugular vein. Second communication is inferior petrosal sinus, straight internal jugular vein. Cavernous sinus, inferior petrosal sinus, jugular. And the third is basilar venous plexus is here, basilar venous plexus to the cavernous sinus. Both the sides cavernous sinus are connected in between by anterior intercavernous and posterior intercavernous. And then last is from the face, facial vein will be going here and it meets the angular vein here. It enters through the inferior ophthalmic, superior ophthalmic vein, and superior ophthalmic vein comes to the cavernous sinus. That's the fifth relation. And the last one is here you will be having a venous plexus. This is the face. Okay, here you will be having a venous plexus called pterygoid venous plexus. Through the pterygoid venous plexus, you have the via the emissary, it will be straight connected to the cavernous sinus. So these are all the relations. So two near the face and one superior petrosal and inferior petrosal, and that basilar venous plexus. Basilar venous plexus is through the vertebral venous plexus connects to the basilar venous plexus. This is the basilar groove, basilar venous plexus. Through that it communicates with the cavernous sinus. These are all the communications, and the communications from the tributaries from the orbit, from the eyeball, from the orbit you will be having superior ophthalmic, inferior ophthalmic and central vein of retina, and then from the meninges you will be having sphenoparietal sinus is present here. This is one of the tributary of the cavernous sinus, and as well as you have the impressions for middle meningeal vein. So this is the foramen spinosum. From here your middle meningeal vein is coming. So these are the tributaries from the meninges. Sphenoparietal and the middle meningeal vein are the tributaries from the meninges. It is draining into the cavernous sinus. Last is from the cerebrum, from the brain you have superficial middle cerebral vein and inferior cerebral vein. These are the tributaries. Last is when there is any injury to the base of the skull, your internal carotid artery is lying on the floor of the cavernous sinus. So it got ruptured. So that carotid blood is entering into the cavernous sinus. Through the cavernous sinus via the superior ophthalmic vein, it enters into the eyeball. So the eyeball will be pulsating. It is called pulsatile exophthalmos. And the second thing is, if there is any infection in the face, it will be going via the facial vein and goes to the angular vein. It enters through the superior ophthalmic vein into the cavernous sinus. That is called as cavernous sinus thrombosis. So one application is cavernous sinus thrombosis. The second application is carotid artery rupture. That is called carotico-cavernous fistula. That's all about the boundaries and relations of the cavernous sinus.